My name's Asunta and I'm one of Dr. Fritz's assistants. I'm going to be explaining post-operative instructions for a connective tissue graft. We want to minimize bleeding afterwards. So the patient is advised that they're not to do any brushing or rinsing for the first 24 hours, and they're not to remove their palatal stent. And I've always explained to them it's very normal to see some red in the stent because the saliva and the blood mixes together, and it looks like there's a lot of bleeding happening, but it's just being trapped by the stent. And I also initially explained that a couple hours after the procedure, when the freezing first comes out, that they'll have a little bit more bleeding once the anesthetic leaves, so that they're not alarmed. But it is key to do no brushing or rinsing for the first 24 hours, and they're to leave the stent in for that full 24 hours. They will be able to brush, I explained to them, because they're always anxious to know when they can brush, that once the 24 hours has passed, that they'll be able to remove the stent, rinse it out with some cool water. Sometimes they can get their delicate toothbrush that will give them post-operatively with a little toothpaste, but really just rinsing it out. The stent, once it's out of the mouth, is going to work very well to clean it. And then they'll be able to brush everywhere except the surgical sites and floss everywhere except the surgical sites and the neighboring teeth to those surgical sites. The delicate toothbrush that we'll give them, they'll be able to use on the biting surfaces and just gently sweeping up just near the teeth, but not near the surgical wound or the stitches. They will then do a little bit of a rinse with water, and not actually rinse, we'll explain to them to just pool that water and let it go in the sink, so they're not actually doing any vigorous rinsing to encourage more bleeding. And then as a last step for their oral hygiene, they'll use the Periodontal mouth rinse to pool in the surgical site so that it will clean around that area. And we'll explain to them it's important that they get it into the surgical sites because that's their toothbrush in a bottle to clean that area out, so that it will allow that to get around the incision line in the stitches. And we'll explain to them that they'll continue doing that for the next 2 weeks, in the morning after breakfast and in the evening before they go to bed. Once you've completed your oral hygiene, then you place your stent back in and you wear that as long as you feel you need to. So it's meant to be there for your comfort. It's meant to be worn when you eat, sleep, or speak. This makes the patient's post-operative recovery much better and more comfortable, and they have full control of the stent. If we have patients who don't like to wear their stent, then we do have a few rules with the stent, but it's not much. Once they get past the 24 hours, they're able to leave it out, but we ask them to wear it the first week while they eat so they don't indirectly damage the roof of the mouth. But otherwise, they can leave it out as long as they feel comfortable. Other prescriptions that we give, the ibuprofen, which is for discomfort, and we ask them to take that for the first day or two by the clock, and we let them know that sometimes they'll need it up to 2 to 4 days after the procedure. And not only will it help with discomfort, but it'll also help minimize the swelling afterwards. The antibiotic we also give post-operatively and initially before we start the surgery to help prevent infection in that area, because the mouth is such a busy place. You have lots of bacteria when you're eating, breathing, speaking. There's always a level of bacteria in your mouth, so the antibiotic helps give you a jump start with the healing. So just a short course of 7 days, and they take 1 capsule 3 times a day until it's finished. So key things that they can expect is swelling. So at about the 3rd to 4th day, they will have the most swelling, and then it will come down after that. And I explained that sometimes it can be around just the surgical site, but sometimes you can see it quite prominently externally. And then what can be followed is some bruising afterwards, and usually that will show up about day 2 or 3 and can stick around for about a week and a half to 2 weeks. Key things that they can help, we always explain to them that rest in the first couple of days. So taking it easy and keeping your blood pressure level will help minimize the amount of swelling, bleeding, and even bruising afterwards. And keeping your head elevated, so when you go to rest or when you go to bed, just a couple of pillows to keep you elevated. And that will definitely help minimize how much bleeding and swelling and even discomfort, because as soon as you lie flat, everything pools, throbs more, hurts more, and bleeds more. So icing will definitely help once all the freezing is out. You can ice the area with a gel pack or a frozen bag of peas or an ice pack, just gently externally, 10 minutes on, 10 minutes off, 3 cycles in the first 24 hours. And we also ask them just to be very gentle with the area. So when they go to brush the teeth, or they have a desire to look at the graft, I ask them not to pull at their cheek and try to have a look. And I explain to them, when they look at the outside of their body, when they cut themselves, the scab looks very different from what it looks like in the mouth, because the mouth is always moist and wet. So there's always a layer of almost, it looks like a filmy white. For some patients, if they can handle it, I'll tell them it looks kind of like halfway cooked hamburger meat. So it's not anything that looks very exciting, but underneath there's lots of healthy tissue. So really the key thing is just not to look. But I kind of give them ideas so they don't really want to look at it after I explain it to them that way. They're always saying, I'm not going to look at it then. There's nothing to see. That the stitches are non-dissolving and that they will be removed in 2 weeks. When they do go back to exercise, that they should start off 50%. If they find it comfortable, then they can push it a little bit further. If they find that the area starts to bleed or hurt, then they should take another couple of days before they go back to their exercise. But not before the day of and the day after. They're definitely going to take it easy. In terms of activities like swimming, they're going to definitely avoid it for the first 7 days. And the reason we explain to them that, so they understand why, is because pools, although we treat them, they still have lots of bacteria. And that bacteria, when you have a wound in your mouth, can encourage infection in that area. So the first 7 days, we ask them not to go swimming with that. I also mentioned that if they decide to take up the tuba, bagpipes, or anything like that, that they shouldn't do that within that 2-week period, that they should avoid that. And their food choices should be room temperature or cooler and softer, and eating on the other side. So things like flaky fish, well-cooked vegetables, meatloaves, quiches, those sorts of things for the next 2 weeks until we see them to remove their sutures are key. And room temperature or cooler is always best. So anything that's hot or warm is going to encourage the area to bleed. So we want them to keep things room temperature or cooler, and always small zips from a glass. Avoid using a straw. And after the first couple of days, then they can slowly warm things up a little more every day. And if I have a patient who really likes coffee or tea, because I really like my coffee or tea, I let them know that they can still have it. It just has to be room temperature or cooler. And then they need to just slowly warm that up once they get past first the couple of days. And I really stress that this is going to help minimize how much bleeding they have afterwards. One of the questions that Candace and I get asked a lot is if they can have alcohol. And we ask them to avoid alcohol as much as possible, especially in the first 4 or 5 days, to avoid it. And then maybe a glass of wine with dinner if it's a special occasion. Same with smoking. We ask them to avoid smoking during that time, and even better, they should quit, because that's really going to help with their healing. And we try to explain to them anything like alcohol or smoking is going to delay that healing.
Thanks for listening, and I hope this was helpful.
We love teaching our patients, so if you have any questions, you can contact us on our website, email, or even call us.